Community Care of North Carolina is a public-private partnership between physicians and the Medicaid program in North Carolina. Primary care physicians from all over the state take part in community care. There are 14 regional networks, and each network consists of primary care physicians who agree to work on quality improvement in the care of patients who have Medicaid. The networks are generally 501c3 organizations, and the network helps practices really be true medical homes in that the network provides on-the-ground care managers, behavioral care managers, consultation from psychiatry, from pharmacists, in order to optimize the care of the folks in those communities. Community Care of North Carolina offers a plan for quality care for all of the patients across the state who are insured by Medicaid. The networks are supportive of their local primary care practices, and they can support those practices by offering care management. The care managers are a significant partner with the medical home, because they can be at the person's home, they can see the patient when they're in the hospital, they may go to a school when the patient is a child. So they are really the extension of the medical home to offer this care. And I think what Community Care of North Carolina has proven over the years is that when you improve the quality of care for patients, you also save a lot in cost.
As a care manager for Community Care of North Carolina, my primary role is to work with complex care management patients. We have a priority population that we focus on, as well as we do provide care management to our entire population. One of the things that we encourage our care managers to do is link them with a primary care physician. Also, we encourage medication adherence, and we are very patient-centered and encourage patient-centered goals.
The care coordination for children, nurses, and social workers who are employed by public health are collaborators in extending quality of care to patients who have Medicaid. So our care management army for CCNC includes our primary care managers and our CC4C, our care coordinators for children. The CC4C folks work primarily with the 0 to 5-year-olds, but our other care managers are going to be working with older children and adolescents.
So as we redefine our priority population, we've included a couple of other priorities. One of them would be foster care. And in doing so, we want to provide care management that focuses on social needs as well as medical needs. So in co-managing with CC4C, one of the things that we would do as a primary care manager, I would focus on the medical needs of the patient, linking them with the primary care physician. One of the areas that CC4C would focus on would be the social needs and working with DSS and finding gaps in care. And so not only do we work with the patient, we work with the caregivers. So a part of that would be making sure that those gaps in care are met and that they're receiving consistent care county to county.
CCNC is interested in collaborating with DSS in the care of kids who are in foster care. So use of the provider portal gives an opportunity for caseworkers at DSS to gather some medical information on kids who come into their care. So on provider portal, they can see things like what medications the child may be on, who their specialists are, who their primary doc is, and whether or not they've had a care manager previously with CCNC. And so that's really invaluable for them to make some contact again with the care manager and with the practice that may have been taking care of the child. So it's a real opportunity for people to be able to communicate and share information about kids who are particularly vulnerable. What we know is that kids in foster care are, by definition, kids with special health care needs, so really need good coordination of care. And it allows for providing continuity of care for these kids. As you may know, kids in foster care often get moved around quite a bit. They change placements, And historically, we lose information about them. And so a new physician is seeing a child and they don't have important information for their health and growth and development. So when we identified kids in foster care as a priority population, that immediately involved our care managers, particularly the ones that work closely with practices that serve children, both pediatrics and family medicine. So we've given them a particularly important role in coordinating care between the network, the practices, and the local DSS folks that are working with these kids. So care managers have a big role in helping the families, both the biologic family and the foster family, and also in trying to be a point of continuity for these kids who get moved around quite a bit. So as we do this work in foster care, we realize that a significant percentage of children who enter foster care are in the age range served by CC4C. So we really need to engage our CC4C coordinators in helping us with the care management of those young children who enter foster care.
Our CC4C case managers and the CCNC network are very valuable to us. Frequently, the CC4C case manager is already in the home when we become involved. They provide us information that we need to make informed decisions. An example I can give is that we had a child earlier in the year that experienced a horrific and traumatic event in the home. The CC4C case manager came to me and told me that they had been involved with the family off and on for years and knew this child in and out. So when we needed the information to make an appropriate placement decision for this child, the information they provided us would not have been had anywhere else. So we were able to make a better informed decision about his placement and ensure his needs were being met there. This whole process has allowed us an opportunity to partner with CCNC where we might not have previously. Our county has been very involved with the CC4C case managers anyway, and they have been wonderful in the service that they have provided our families and the information that they've provided us. But the network offers a continuity of medical information for the child that comes into care. That continuity allows us to ensure that the child's medical needs are being met. Many of the kids that come into care are identified with at least one chronic condition. So this does allow us to identify that chronic condition and identify the trauma behind it possibly and meet the needs of the child. This partnership has allowed us to share information and needed information so that the medical professionals have what they need from us to ensure that they don't miss something in their assessment of the children when the children come into care, and allows us to gain the information from the medical professional to make informed decisions as to what this child might need from us. So this partnership is completely focused on our kids and really benefits all parties in the community. Before this initiative, I was unclear as to what the medical home program was, how it would benefit us as an agency, and how it would benefit our children that came into care. Since joining this initiative with CCNC, I have discovered that it opens the doors to communication with our medical professionals, our community partners, our foster parents, and provides a sharing of information that allows us to make sure that our kids' needs are being met. They're the focus of this program. We've had several unexpected outcomes from this initiative. One is the great partnership that now we have with the community members. The other is that our 3 counties that have partnered with CCNC of Southern Piedmont had a relationship, but maybe not as good as we would have liked. And working together and joining together to produce a positive outcome for our kids through this program has really improved our relationships with each other. So, and if you have an improved relationship at a management level, it trickles down with your staff. If you have the ability to communicate good and bad with each other, problems, positive events that have occurred, it really encourages everyone to work together. Our families move from county to county to county, and a partnership with each other allows us to share that information even better than just looking at the documentation that we've got. So that, again, is focused on helping these children if we have all the information that we need to make these informed decisions.